table, but this acute sinus condition of his is holding up the works.
Wonderful. Let's volunteer him. And let's get out of here. Start fresh tomorrow.
Okay. Listen, I'll talk to Farrell, and I'll have to clear it with Trapper. After all, Farrell is his patient.
McIntyre?
Yeah.
Oh, let me have the pleasure. It's been a long time.
So I've heard.
Oh, here's some homework for you.
Uh-huh, thank you. See you later.
Mr. Farrell.
Oh, so you made up your mind about my life insurance offer? You doctors are always good at lengthening the lives of your patients. But when it comes to your own insurance needs, you come up short.
How are you feeling?
Outside of this pain in my side, this lousy head cold, I'm just great.
Okay, we'll schedule you for surgery as soon as that cold is gone, and well, it shouldn't be more than a few days, and your gallbladder will keep.
A few days? That's not what Dr. Waleska said. Well, she gave me a shot, some kind of cold serum, and said my head should be clear by morning.
Waleska?
Yeah, real nice lady. Underinsured, too. I might be able to sell her a policy. Hey, where are you going?
Some unfinished business.
Oh, okay.
Oh, I knew you'd find your way down here eventually.
You know, I could put you out of business for tampering with my patient.
Farrell?
You know you were giving him an experimental serum?
Oh, why worry the man?
Why didn't you clear it with me?
Oh, come on, Trapper. I don't have time to perform that bureaucratic ballet.
Oh, boy. Same old Liz. You got the ethical standards of a hyena.
But I'm loads of fun at a party.
I'd have thought you'd learned by now. How many lessons do you need?
Oh, I have learned, John. But let's face it, I'm just the rebellious type.
A little rebellion now and then is a good thing, but...
Thank you, Thomas Jefferson.
But chronic rebellion is an endangerment.
Jefferson?
McIntyre.
All right, let's cut the fandango. You have your style, I have mine. Why don't we just wait and see how Mr. Farrell responds to my treatment?
As long as you're here, kiddo, you're gonna play by the rules.
You forget I have carte blanche from the board for my research.
Down here, not with my patients. Morning.
Morning, Doc. When's my date with surgery?
Well, you're sounding clear as a bell.
Oh, you can thank Dr. Waleska for that. The lady's a miracle worker. One shot, and it was sayonara to my sinus trouble.
No sore throat?
No.
No facial pain?
No.
Well, I still want to run you through a few more tests before surgery. Can't be too careful.
I'm A-okay. When you see Dr. Waleska, tell her thanks, will you?
Trapper, here are the blood tests on Mr. Farrell.
I didn't order these.
Dr. Waleska did. Said she wanted to follow through on her treatment and save you time. By the looks of these, he's fine. No negative reaction to her cold medication. Well, you're welcome.
Well, this paperwork must drive you nuts.
Yes, it does. But it's there for you when you've got the questions. Unfortunately, in research, you've got an armload of questions and a handful of answers.
I guess. Thank God for computers.
Oh, greetings. How's Farrell?
Ready for surgery. You're lucky. Let's hope there are no side effects.
Did it ever occur to you that it wasn't just luck? I have been logging experiments on that medication for over 6 months.
Time out. How about some coffee?
No, I've tasted that tile cleaner you call coffee. How about some of my coffee? I grind my own.
No, thanks.
Lighten up, will you? A little credit where credit is due.
She was out of line.
Well, keep an eye on her.
boys, please. No talking behind my back. Unless, of course, you're arguing about who's going to ask me out to dinner.
You all right?
Yes, I'm fine. I'm just preparing for the prom.
Why don't you sit down?
No, I'll be all right. It's just hyperventilating.
I don't know. She attributes it to stress, to exhaustion. Maybe she's right.
Come on. Since when have you seen seizures like that? I mean, that was a classic respiratory distress, my friend. Unless, of course, she's taking drugs.
No way. Liz is not taking any medication.
Liz? Our Liz Waleska?
Well, the drug screen will tell us for sure. The lab ain't gonna lie.
What makes you think she would?
Liz Waleska popping pills? No way. Maybe she's experimenting on herself.
Maybe.
Oh, come off it, Trap.
Well, Madame Curie did. I mean, after all, you were the first to point out that they have something in common.
That's it, Liz Waleska. The modern-day Madame Curie.
I don't believe you. What have you got against her? Okay, she was a little impulsive. She messed with your patient.
Messed what? How messed? Who? What?
But she helped him, didn't she? I mean, doesn't she get any points for that?
Helped who? When? Why?
All right, so she's bright, gifted, hardworking. But she'll also stop at nothing to get her own way.
Why? What else has she done?
Yeah, John, explain.
Go back a long way. I gotta run.
Ooh. This is top drawer stuff, my friend. This is front page news.
You can't print this, Stan.
You expect me to sit on this story? No way, baby. The public has a right to know.
Know what?
This, right here. Every word, every nuance.
Stan,
Uh-huh.
next time you use this thing,
Yeah.
push record.
Court.
Yeah, you're still overheating. Your blood pressure's unstable. I want to keep you here overnight, Liz.
Oh, no.
Oh, yes. Want to notify your husband?
No, thanks. And for the record, it's my ex-husband.
Oh, sorry.
So am I. Didn't work. He was a good man, too. Tops in his field. Music. A mensch. Pretty good in bed, too. I'm the one who fouled up. He kept having to drag me away from a hot test tube. Now, is there anything else you want to know about my raunchy personal life?
Yeah. Let's get really personal. Do you have any medical problems?
Well, I'm a workaholic, a stress-ridden sugar fiend. I'm also at the age where those penalties start to show up.
Well, that still doesn't explain what happened to you.
Oh, come on. I had a little attack of the vapors. Big deal.
Liz, if those seizures were any more intense, we'd be treating you for whiplash.
Gonzo, you're exaggerating. I'll be fine, really. I feel better already.
Taking any medications?
No?
Drugs? Narcotics?
Oh, come on.
Anything in your medical history we should know about?
Doctor, your diligence is beginning to bore the hell out of me.
Liz, I want you well.
Me too. I've got too much to do than to lie here and count the cracks in the ceiling.
Well, for the time being, you're going to stay right here and get some rest.
Please, let me be a good girl in my own lab.
Don't worry about the lab. I'll be down there organizing.
Oh, no, you don't. That lab is my castle, Junior. By invitation only. I want it locked up right now.
Okay, have it your way.
By Jove, I think you've got it. What are you doing here?
Cleaning up. Do you mind stepping aside, please?
Who authorized you to come in here?
Look, lady, I just happen to be your neighborhood janitorial technician.